Welcome to Your Health.
You should not ignore the early warning signs of colon cancer. Because it may take a tumor a long time to manifest symptoms, colon cancer is sometimes referred to as the silent killer. Each year, there are over 100,000 new cases of colon cancer recorded, which affects both men and women equally and results in close to 50,000 fatalities. The condition known as colon cancer causes the large intestine's normal cells to proliferate abnormally. While it's impossible to predict with certainty if colon cancer will manifest, there are several early symptoms that could be concerning. 9. Early indicators of colon cancer. Number 1. Modifications to bowel routines. The average age at which colon cancer is most likely to develop is 60. Although younger people can develop colon cancer, it is more common in those over 65. Constipation is frequently the first indication of colon cancer. A colon that is healthy typically experiences regular bowel movements every day or two. The feces ought to be soft, brown, and simple to pass, without any blood. If you notice a difference in how frequently you use the restroom or if your stools become hard and challenging to pass, it may be a sign of something serious. Number 2. Diarrhea. For those who have colon cancer, diarrhea, or loose stools, is a typical issue. In medical terms, diarrhea is the passage of 3 or more immature feces. According to the National Cancer Institute, some patients may contract parasites or bacteria that cause diarrhea. Number 3. Constipation. It is widely known that the colon is where waste is eliminated. It is also in charge of how well our food absorbs nutrients and water. This may result in the colon becoming obstructed and unable to operate normally. Constipation is the outcome, which can be unpleasant and uncomfortable. Constipation may not first seem to be a big deal, but it can be an indication of colon cancer in its early stages. More than 80% of individuals with colon cancer diagnoses. Constipation can result from a number of factors, including pharmaceutical side effects and inactivity. It might be challenging to distinguish between ordinary constipation and a more dangerous condition like colon cancer. Consult a doctor if your constipation persists for more than 3 days, especially if you are also suffering abdominal pain and bloody stools. Before we move on to the next symptom, if you're enjoying our video so far, don't forget to hit the like button and subscribe to our channel so you never miss out on our new educational films. Number 4. Blood in your stool. One of the most curable malignancies is colon cancer. Colon cancer has a 95% 5-year survival rate if identified early, acquire colon cancer at some point in their lives. The likelihood of survival is better the earlier it is discovered. The presence of blood in your stool may be a precursor to colon cancer. The portion of your digestive system that retains stool before it is expelled from the body is called the colon. Numerous types of cancer and other illnesses can result in bloody stools. Diverticulitis, hemorrhoids, and ulcerative colitis. Usually, big intestine inflammation or damage is the cause of blood in the stool. Additionally, it could result from bleeding in other areas of the digestive system, like the stomach, or from ulcers. Some medications, including antibiotics like ciprofloxacin, antidiarrheal medications like lactulose, and iron supplements, can also result in bloody stools. Number 5. Bleeding from the rectum. The presence of rectal bleeding could indicate colon cancer. The rectum, which measures around 5 inches in length, is the final segment of your big intestine. However, rectal bleeding is a pretty frequent symptom, and the majority of people who have it do not have colon cancer. Hemorrhoids and anal fissures are a couple of other conditions that may cause bleeding in this area. A polyp or other growth on the surface of your colon could potentially be the reason why you're bleeding from the rectum. Number 6. Undiagnosed bloating or pain in the abdomen. Genetics or lifestyle decisions, such as food and exercise habits, can increase your risk of colon cancer by up to 30%. 10% to 15% of all cases of colon cancer are hereditary in nature. While other variables including a bad diet, being overweight, smoking, and drinking alcohol account for a 5% to 10% risk increase. One of the most typical signs of colon cancer is bloating. It might show up in the early stages of the disease, or it might be a sign of another ailment unrelated to cancer. Bloating, which can be brought on by gas, is a sensation of fullness or swelling in the abdomen. Additionally, certain foods or medications may induce it. Try eating smaller meals more frequently throughout the day instead of 3 large meals per day if your stomach feels bloated after eating. This should help manage blood sugar levels and help prevent bloating brought on by overeating. Number 7. Feeling exhausted all the time. Colon cancer symptoms frequently appear gradually and lack obvious early warning indicators. Feeling exhausted is extremely normal and can be brought on by a variety of things, such as staying up late or not getting enough sleep. However, if you experience fatigue more frequently than usual and it persists even after a restful night's sleep, it can indicate that there is a problem with your body. The colon is in charge of eliminating waste from the body through feces. Toxic accumulation in the digestive system can happen when this process is slowed down or inhibited. If this persists over time, the colon wall may develop malignant tumors. If you experience fatigue frequently and any additional symptoms, such as bloating or stomach pain, this could be a warning sign of colon cancer. Number 8. A rapid loss of weight. The location and stage of the tumor influence the symptoms of colon cancer. Sudden weight loss may be a warning indication for gastrointestinal conditions like colon cancer. In particular, it is very acceptable to have lost some additional weight if you are an older adult and have recovered from a sickness. If you've dropped more than 10 or 15 pounds over a period of time, colon cancer may be present. Number 9. Constantly feeling full. Exercise is important for preventing colon cancer as well. If you constantly feel full, even when you aren't eating anything, this may indicate that there is something wrong with your digestive system. Bloating, constipation, diarrhea, and other digestive problems brought on by colon cancer may make it challenging for people to eat properly. These symptoms are typically modest at first and simpler to ignore or brush off. If you experience any additional signs, such as exhaustion or weight loss, you could delay seeking treatment because you believe your problems are wholly unrelated. Eat well, move around, and keep your weight in check. You have a higher than normal chance of acquiring colorectal cancer at some time in your life if one first-degree relative, such as a parent, child, or sibling, had it before age 55. You have a higher risk than average if 2 first-degree relatives have had colorectal cancer before age 55. Remember that these can be preliminary symptoms of colon cancer rather than established ones. And if you do have any of the colon cancer risk factors mentioned above, be careful to ask your doctor if colonoscopies are the best option for screening.
Join the conversation in the comments below as we share our experiences and tips for healthy happiness. If you found this video helpful, don't forget to give a big thumbs up and subscribe for more refreshing content like this. You'll be healthy. Check out the next video.